We have with us today Dr. Preetha Reddy, Vice Chairperson of Apollo Hospitals, and Dr. Suneeta Reddy, MD at Apollo Hospital. In this episode of Corner Office Conversation, we discuss a length of subjects from how the journey has been for the hospital for the last 4 decades and what holds for the future. Welcome to Corner Office Conversation. My first question will be to Dr. Preetha Reddy. Ma'am, give us a good lowdown about how it all started and how has this been a formation, a phenomenal formation of India's first private sector healthcare company.
Thank you, Vikas. I have to say that it has been a journey which is very heartening. And it all started because there was a young patient of our chairman's who could not go to the US in time for surgery. And at that time, chairman was very clear, my father, that we should be doing something for our people in India, bring the best in class globally for the people of our nation. And I think most institutions come into being because there's a crying need in society to do something good. And that's the story behind everything which has happened in Apollo. The journey has been exciting. It has been worthwhile. But like we always say, we're in the business of caring. And if we get the caring right, the business follows. So it's grown from hospitals to clinics to pharmacies to a digital ecosystem to training, skilling. But somehow it feels like there's so much more to do. And I think as a team, while there is 4 of us, there's a fantastic team of professionals who are with us along this journey. And we will grow in the healthcare space and contribute not only to India, not only to healing in India, but try and see how we can position India as a global healthcare powerhouse. So that's the vision and that's the dream.
Wonderful. Dr. Suneeta Reddy, I was reading the book Healers, where there is a mention of Rakesh Junjunwala speaking about Dr. Prathap Reddy's uh, whole enterprise and the initiative. And it's about sometime in 90s when he actually spoke about just one hospital in Chennai doing some great work. And the concept of profitability at that time did not exist. Your take on what actually has happened in the last 42 years? What were the most critical moments that you feel can be actually said now?
I think the whole perspective about there was a structural demand for healthcare. If you look at the size of India's population and the number of beds that existed, even according to the WHO definition, which is 3 per thousand, we needed to you need 42 lakh beds, and India today has only 16 lakh beds. So definitely another 24 lakh beds. And most of it at that time was in the public sector and in the charitable space. So we do recognize the need that organized healthcare has played in uplifting not only the outcomes in terms of, 80% of the Indians at that time used to go abroad for treatment. By creating Apollo, now we get people from 147 countries. So we're serving a structural demand. We're creating an ecosystem which is more than just India. And I think Rakesh realized that we were doing it at a very good value proposition, which is at 1/10 of international cost. And therefore, Indians had access. They had outstanding clinical outcomes. And, we had an opportunity to do an organized healthcare sector play at scale.
Right. Absolutely. Yeah. And it's actually laid the kind of roadmap for so many other enterprises which have actually come up. Dr. Preetha Reddy, from your vantage point of view, now there is a lot of competition. So many private equity companies have come into the healthcare sector. Uh, from Apollo's point of view, you still remain as the flagship healthcare company from India. How do you see the competitive landscape changing? You're probably one of the very few companies which have still been not fully owned by private equity. How do you want to see the journey going forward?
So I actually want to say this, that private equity invested in Apollo for the first time when they came into the country, and Suneeta was instrumental in that whole journey. Having said that, private equity does bring a certain discipline into what we do and how we handle the hospitals, and that is a good thing. But for Apollo, we're a very clinician-driven organization. For us, it's the clinical outcomes. It is how can we give the best in class globally to the patients so that in any corner of India, they get the best care. And I think that's what drives us. And that's what's kept us going for the past 42 years. And there's a fantastic pipeline of, clinicians who come into the system, who take over and who do the work. But apart from that, we've got a great strength in our nursing and in our support system team. And while we're running 15 nursing colleges which help us, we're also trying to see how can we train them better, how can we recruit them better. And this core team, which is positioned around the patient, around the way clinical work is done, is probably what has kept us going over the past 42 years. And we're constantly changing. We're trying to see what is a better model, what is a different model of doing things. And the fact that we want to be nimble, that we want to be quick without losing focus on quality and outcomes is what makes the Apollo journey really exciting.
How do you see your role changing? The first 42 years have been absolutely transformative. How do you see that responsibility growing on your organization?
Well, I think we have to find different ways to access. There is geographical access, and we're using technology in multiple ways to deliver that, whether it's telemedicine or smaller format hospitals in different locations. So geographical access is something which we're reinventing, trying to think of every day. And then there is financial access, and there are many models which have come into the country, including different models of insurance. So I think people will find access into hospitals. But the biggest challenge, and my father's constantly telling us, we can build beautiful hospitals. We will find ways to fund it. We will equip it with the best in class. But it's the people who make a difference. And for that, I think we need to be able to skill, to be able to train. I'm so glad that the government has really relaxed the norms on medical schools and they announced 157 nursing colleges. I would have been happy if it was 1,570, just one more zero. But having said that, there is a lot to be done in that space. And I'm sure that you will see not only Apollo, but many others coming together to see how can we skill people for better prospects, not only for the sector, but for themselves, because, this is a huge opportunity for jobs. And that is why we're beginning to focus on that too.
Right. Dr. Suneeta Reddy, your take on what actually holds for the future? How do you see the future panning out?
No, I just want to go back to what my elder sister just said about, investments into healthcare. It's good that, that the government has allowed FDI into healthcare, because 65% of the healthcare today is by the private sector. And unless the private sector continues to invest, whether it's to upgrade or to create more infrastructure or to invest into new technology, it will be very hard for Indians to isolate it from the rest of the world. And therefore, I think it brings value.
Yeah, so, more or less what we have seen in the last 5 or 10 years, the advent of NGS, use of robotics, the medical technology bringing in a revolution in itself, cancer detection, and Apollo has been at the front end of all of these. What can AI, of course, I mean, I can't be forgetting AI. You have actually employed it in a big way. Do you think this probably will change the shape of healthcare that we have seen in India? We still have a massive gap between care delivery and what we actually see. So, what do you think?
Yes.
So, yeah, with you first, Dr. Suneeta Reddy.
For me, it's the ability to democratize healthcare. As you think about AI, it's really about how do we use AI to create the diagnosis, help in the differential diagnosis, and do it remotely. So we're able to multiply, we're able to deal with large volumes because we built this clinical intelligence engine. And this clinical intelligence engine that Apollo has is based on the learning of 40 years of data. And using this, we're able to do the clinical intelligence age, where, a person can today call Ask Apollo and have, get a diagnosis based on the symptoms that he presents. And then, reach out to a doctor where he is able to do it very quickly to reach diagnosis, use a differential diagnosis, and come out with a solution. And with it, we have, of course, the personal health record where, we're able to personalize healthcare. And I think this is crucial, that you're able to give not a one size fits all, but a personalized health solution. And that's what AI does. It's able to give you these solutions. And it's able to do so with speed, accuracy, and as I said, it's a force multiplier.
Indeed, it is. Yeah, absolutely. In fact, if my memory goes back to some 20 years, I was at Madurai, a tribal district, I think somewhere in Theni, where Apollo actually did their first experiment with Philips and another patient group of reaching healthcare, and that was telemedicine. It was still very far from a mass reality, and at that time, it appeared like, will it really happen? And now the adoption has been so phenomenal. So, on that, probably do you think the next 4 decades, 5 decades, we will see a very different healthcare structure? Dr. Preetha Reddy, you want to take that first?
So that Teni experiment, thanks to referring for that, we were all there and very excited by what it does. And from then to now, it's like anywhere, anytime, doctor consult medicines, because that's what Apollo 24/7, which my sister Shobana started and runs, is doing. So technically, you can be anywhere and you can get access to high quality information. You can have a doctor consult and you can get your meds on time. And that has been a quantum leap. But what is going to happen in the future is, one, you will have literally your whole health horoscope available, because we are investing, we're working with genomics very seriously, very in depth, so that, and we're trying to democratize the cost, because right now it's expensive, but I know that the cost of genomic analysis, genomic studies is going to go down. And once you have this information, the way you deal with healthcare, the way you deal with disease, the way you prevent the onset of disease is going to change dramatically. Because, people will not have to get to a situation where it's literally dire straits, because you will be able to predict, you'll be able to see the onset of disease. And this is real. This is going to happen, it's happening in very small pockets globally. But it will happen, it will leapfrog in India, because there is a strong commitment both from the government and the private sector to be able to make this difference. So I think that is going to be phenomenal. People are not going to need to travel long distances to access healthcare, because it's going to be available to them. And a lot of it will literally be in their hands, because your smartphones are going to deliver so much more, whether it's diagnostics, whether it's information, all that will be there. And the power of AI, because we are still not able to get diagnostics, because we don't have enough people to make a accurate diagnosis. So you will be able to use AI, clinical information engines, for accurate diagnostics. But more than anything else, I constantly am saying this not only to our staff, but to whoever, that high tech can never replace high touch. So, while the clinician or the caregivers have so much of, information available, it will give them more time for the high touch. And I think that's what humans want. As a race, that's what we want.
So my next question will be to Dr. Suneeta Reddy. Um, the hospitals have been building up at a frantic pace, and we have seen massive build
Yes.
up in cities, and everyone is actually rushing to kind of invest many millions of dollars in big hospitals, while tier 2 tier 3 smaller towns are still something that has been approached. We are seeing some kind of action there too. Do you think that's probably the same model that will be followed probably in the next 5 decades? I mean, you've completed almost 42 years.
Yeah.
How do you see that part getting bridged? Do you think that that kind of a disparity will go?
Definitely it'll go, but I think, when people talk about everyone expanding and so many beds being created, people keep asking me, how will you manage the competition? Which is why I just want to put this, like I think I've said this before, but this figure that, we need to create 20 lakh beds. But do you know in the organized sector, there are only 1.5 lakh beds. And when you talk about corporate healthcare, there are only 48,000 beds. So clearly, and with Apollo's 8,950 beds, it is only 10% of the healthcare system. So we do need to grow. And we do have an expansion plan, which is really adding capacity. We're looking at adding capacity. We're adding about 4,000 beds. There's a 6,000 crore expansion plan. But we must recognize that Apollo has looking at a network, creation of a network. So 30% of our beds are already in the tier 2. We see them as very important referral centers where people will go for primary, secondary, and some tertiary care work and get referred to the city for the high-end work, where we're currently at 8,900 beds and moving to about 14,000, 13,000 beds. It also includes the pharmacy, where we have 6,700 pharmacies, which is, this whole company set up by Shobna, which is Apollo Health Co., and goes beyond, which is the first omni-channel play in healthcare. So Apollo should not be defined by just number of beds. It's about creating these networks of care which move, which move closer to the consumer.
Right. Yeah. So going beyond just the beds, creating a network of care. I
Yeah.
think that's a great point. Um,
Yes.
yeah, and I mean, probably a couple of months ago we heard about the demerger and the spin-off of your digital business,
Yeah.
and it's a very ambitious plan.
Yes.
FY27, I think 25,000 crore. Uh, is that a very strategic plan? Do you think that's exactly where a lot of growth will come? How does a normal investor look at this change or the dynamic?
Yeah. Oh, I think you should ask Shobana. We are very confident she'd deliver that 25,000 crores of revenue. And it's not just empty revenue, because it has a very healthy 7% margin. And it is possible, and I think Apollo is uniquely positioned to do so, because it's created the infrastructure in terms of physical, it's created the digital infrastructure that connects all parts of it. And with this structure, what happens is this new company, Apollo Health
Yeah,
Technologies, will see the demerger of Apollo Health Co., which is the pharmacies and the digital. It'll see the merger of KeyMed, which is the supply
exactly.
chain. And it will eventually, in a period of time, the front end will also get merged into this. So it's really bringing together three entities. It's creating value for every shareholder. It's creating value for patients, because they now have a company that's totally focused and close, accessible to all of them. And it's completely compliant with all of the government regulations. So I think this is definitely a breakthrough in terms of creating this size and scale of company, which is also profitable.
Preeta ma'am, talking about your father, I mean, he's defined the healthcare map of India uh, over the last so many decades. Um, what are the things that you actually imbibed from him? All of you four sisters are deeply embedded in the healthcare delivery. All of you have been doing so well. How do you actually see this whole, knowledge sharing and the inspiration that you draw from him? It must be very challenging to be in your position, because he's really given so much to the sector.
Moral of the story, if there were 4 more daughters, we still wouldn't be able to run at that speed or to measure up to everything which he does. He started off with us at probably a very young age, and he continues to do it, is that he will call wherever we are and say, "What good things did you do today?" So I think there's a huge philosophy behind it, because we're constantly trying to see what good can we do, whether it's in our area of work or just humanity, or multiple things which we have to do as people. So I think that has really been one of the best learnings from him, and there's no going away from it. He is also deeply spiritual. So it is like many hours of meditation and puja, but absolutely no compromise about work. So I don't know, that sense of balance between spirituality and really giving your 100% to work, that sense of balance comes amazingly well from him. So we're trying to do that. But I think what really keeps us together and what binds us together is that a lot of our talk or our decisions is more about what can we do for the business. I think Apollo is more than 4 children, is probably the first child. And it is what more can we do? And any decision has to be that, what is it the best for Apollo? Is it the best for business? And that is why you see that, if Suneeta was just explaining how the thought of spinning this off happened. And it was only because it was good for the patients and good for business. So I think this is the culture which he has imbibed in us. And we interact like, I would always respect Suneeta's wisdom. And even just before this, we had another conversation about something else. And I said, I'm very happy to go with whatever she says. So many times this is what happens, that we draw from each other's strengths. And I think we're truly blessed that we're able to do that. And each one of us probably brings, something to the table, which is what we have kind of honed. Not to perfection, there's still a long way to go, but we recognize the strengths in each other. And I would do the same with Shobna or Sangeeta. And that is a value system which I think my dad and my mom have inculcated in us, is that, talk to each other, you're all equals, and each one has a strength, learn from it. So I could go on forever, but I think these are like few things which we've learned.
Then let me
Yeah.
add to that.
I was just going to say, Suneeta will add to that.
No, I'll just make it simple. It's just, Dad always had this concept of the Apollo family. It was never just 4 of us and him and mom. But, from the day we started, it was Apollo family. He used to tell us, get up in the morning and say, good morning, Apollo, because he believed in the Apollo family. I think the second thing is, trust. Trust in people, and I think that's worked well for 4 of us, that you respect each other. The third is, having the ability to let go. If I say, oh, I keep asking questions on pharmacy and preventive and say, okay, I know this also, the belief that you should let go. Chairman had so much trust in us, and he let go and let us take it forward. And I believe that this is what we need to do with our children, what we have been able to achieve because we've had professionals work with us. So it is a very professional, focused organization that moves forward, because we know that, that we're all in this together and that we're here to do the best.
Oh, absolutely. Yeah. So, do you all still go to him, discuss issues, problems? Does he still find himself in the center of giving solutions.
Suneeta, you
So
go
dad
first.
comes to work. Dad comes to work every day. So while he has all the information. Do we discuss problems? Yes, we do. I think it's always at a level where four of us discuss it first. And nothing goes to chairman unless he finds out something else. Where we discuss it and we're able to go with the solution, and of course we take it to him with the solution. So we're talking constantly, and chairman is still calling the shots, because at the end of the meeting we always say, yes daddy, but we also at this age are able to say that this is what is happening in the rest of the world, or this is how healthcare is changing. And that's where you see the young chairman, because he really wants to know what is the next level of change, and he really wants to bring it to India ahead of its time, like he's done with the proton.
Yeah.
And it is that level of having an open mind and seeking knowledge that we want to bring the future to India before anyone else does.
So,
That keeps the pioneering spirit alive.
one quick word from both of you. First with Preetha ma'am, how do you see the next 10 years for Apollo? Because the dynamics are changing so quickly and so fast. Where will Apollo be?
So I'm going to be a good elder sister, and I'm going to say first Suneeta, because she's the MD and she's going to sign off for the next 10 years. So let me get Suneeta to go first.
No, I think in the next 10 years, we're going to build out these networks of care. And we're going to, we will reach scale. We'll be relevant for all of India in some format, whether it's through telemedicine or through our clinics. But we will be relevant in terms of having significant market share. But we will also be relevant to the rest of the world.
Right. In numbers, can I nudge you to give out some more details? Maybe, in FY25, it was about
No, I think that
22,000 crores.
So if you look at the unique thing about our business model is that while we have these three verticals, so hospitals, because of the larger base and the margin, the nature of the business, our existing hospitals will continue to grow at 20%. The new hospitals will bring on board in the next 30 months another 6% growth. So we will always have a vertical that's growing at 20%. And Apollo HealthCo will grow at 20%. Apollo hospitals would again reach that when the new hospitals open. And Apollo Health and Lifestyle, is as it deepens its penetration strategy in diagnostics and primary care, will grow at 20%, 25%. So I think we will continue to make these investments to guarantee a CAGR of 20%. And when we do so, we've always looked at, making sure that we're sustainable, creating margins, and of course, creating those profits to invest into the future.
Right. That's a very ambitious plan on a base which is already so big, and I'm sure it actually speaks about the optimism of growth of healthcare in this country. Preetha ma'am, final words from you.
So, I'm a very proud Indian, let me say this. And I do want India to be able to do much more in the area of health and medicine, which means that an Indian living in India must win the Nobel Prize for Medicine. I think that is something we should aim for. There is so much to be done in the area of research. I mean, we were the ones who brought out COVID vaccine so quickly and to that large scale. So we're capable. We're capable of really putting a satellite into space at 1/10 the cost. We're capable of providing the highest quality of healthcare at 1/10 of the cost. So I think we need to be able to literally become a healthcare powerhouse. And in years, hundreds of years gone by, it was Ayurveda and all. India was a home for all that. But India must now lead the way in being able to deliver the highest standards of allopathic medicine for our own people and definitely for the rest of the world to look up to us. So I know that there's a lot to be done in that space, but there's so many things which have been put in place that we can actually do it. And so the future is exciting. The next 10 years will see so many things happening in that place. We're very lucky to be here at this time to be able to contribute back. So let's get together, collaborate, and make the world a better place for the future generations.
Right. Wonderful. I think we've covered quite a lot. In fact, from the changes that we will be seeing in the healthcare sector, the need of translational research, the huge population that we have, and of course, the ambition of being a global organization. So Apollo has actually covered it all. And all the best for your future journey, ma'am. And, we will be watching it all very closely. Thank you so much and all the very best again.
Thank you and namaste. Thank you.
Thank you.